Hey guys, Dr. Michael Bracchio here at Velocity Sports Rehab. In this video, we're going to go over Achilles tendinopathy. First, let's start with a little bit of the anatomy of the calf. So on the back of the calf, we have two major muscles, which are your soleus and your gastrocnemius muscles. Both of those muscles taper down to form the Achilles tendon, which wraps around the heel and then blends into the plantar fascia. Together, when these muscles contract, they do what's called plantar flexion, which is when you point your toes away from you. Tendinopathy is generally considered as an overuse injury. So what typically happens is that you've exceeded the tissue's capacity to absorb load. Clinically, tendinopathy is divided into two different stages. We have a reactive stage and then a degenerative stage. In the first stage of tendinopathy, which is the reactive stage, the tendon is reacting to the increase in load that's being placed upon it. The way that it does this is that it increases production of tendon cells, which will increase the fluid that accumulates in the tendon. In this stage, the tendon is typically swollen and a little bit tender to touch. In the degenerative stage, we've had chronic loading of the tendon. So what happens is the increase in fluid keeps separating the collagen fibers in the tendon, which leads to massive disorganization of all of those collagen fibers and also degeneration. The treatment of a reactive tendinopathy is really load management. So like we were talking about before, it's an overload. So we're trying to manage the load that's being placed upon the tendon. We're not going to remove all load from the tendon because the tendon is still going to adapt. So we want to just decrease the load that's being placed upon it so that it has the opportunity to adapt. For example, if we're dealing with a runner who's running 5 days a week, we might only decrease them to running once or twice a week. Or if they're running 10 to 15 miles a week, we might decrease them to somewhere between 3 and 5 miles a week. The changes in training are all going to depend on the individuals, with some needing more rest and some needing less. In the second stage of tendinopathy, which is the degeneration stage, what we're going to do is we're actually going to increase the load on the tendon. What we're trying to do is we're trying to stimulate the tendon to rebuild. Any of the tendon structure that has been degenerated isn't actually going to grow back, but we can stimulate the tendon to rebuild some tendon structure around that so that we have a nice supportive structure around it. To load the Achilles tendon, we'll do heel raises. So what you'll do is you'll slowly raise your heel off the ground, standing up on your toes, and then slowly lower it back down to the ground. To progress the loading, you can either add weight or you can add a jumping motion where you're jumping on your toes. To decrease the pain in tendinopathy, you really have a couple options. One is manual therapy, where you'll do either like a pin and stretch or an active release technique on the calf and on the Achilles tendon itself. Or you can do what's called Graston therapy, which is a little metal instrument used to rub over the skin. Both of these techniques will desensitize the tissues, which will make loading a little bit more pleasant. Another option is to do an isometric hold, which would be for the Achilles just to lift your heels off the ground and hold them in a static position. This has been shown to decrease the pain in the patellar tendon, but can also be used for the Achilles tendon as well. It's important to note that pain can occur in any of the stages of tendinopathy because it's not related to the tendon structure itself. So whether you're in the first stage or the second stage of tendinopathy, you can have pain in either of them. Thank you for watching our video on Achilles tendinopathy. I hope that you found it helpful. If you did, don't forget to like and share this video.